Welcome everyone to today's webinar, Transforming How Patients Access Care with AI-Powered Intake. On behalf of Becker's Healthcare, thank you for joining us today. Before we begin, we're going to walk through a few quick housekeeping instructions. If you have any questions throughout today's webinar, you can type those into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log in to today's webinar to access the recording. Lastly, if at any time you have trouble with the audio or video, please try refreshing your browser. You can also submit any technical questions into the Q&A box, and we are here to help. At this time, it is my pleasure to introduce our presenters, Suzanne Katz and Kevin Huang. Suzanne leads Notable's Access and Engagement Solution Development, where she aligns digital solutions with intelligent automation to support daily healthcare operations and improve patient outcomes. Formerly working as an administrator at top healthcare organizations, including Johns Hopkins Health System and the Hospital for Special Surgery. Suzanne directed operational and digital access initiatives, instilling best practices across service lines through facilitation of clinical, administrative, and technical partnerships. Suzanne holds a degree in Design and Environmental Analysis from Cornell University and Master of Health Administration from the Johns Hopkins Bloomberg School of Public Health. Kevin currently leads the Machine Learning and AI Engineering team at Notable, where they develop natural language processing and computer vision models to enable intelligent solutions that automate complex healthcare workflows. Prior to joining Notable, Kevin was the data science technical lead at Change Healthcare, responsible for developing the Claims Lifecycle AI API. He graduated with a PhD in electrical engineering from Stanford University in 2012. So without further ado, I'll pass it over to Suzanne.
Thank you for joining today's webinar, Transforming How Patients Access Care with AI-Powered Intake. Kevin and I are thrilled you've joined us for this discussion on how intake solutions designed with intelligent automation can be a game changer for healthcare organizations. We'll focus today's discussion around Notable's intake solution, highlighting opportunities for improving the patient experience and access to care. Each section of today's webinar will be based on answering a key question. First, what are the challenges of the current intake status quo? Then, how do we build the right kind of AI to deliver true value? In this section, we'll take you through core methods to navigate the complex and fascinating world of machine learning technologies. Next, how should intake solutions be evaluated? This is where we'll discuss the outcomes and the details that matter to achieve the full growth potential of intake. Finally, we'll end with the Q&A. Please feel free to submit your questions throughout the webinar. Previously leading operational teams within larger healthcare systems, it was easy to see that collecting information from patients up front was always described as a difficult challenge. While clinicians and staff want their patients to be prepared for their visit, the effort to collect that information can be extremely burdensome, causing unintended outcomes. This has positioned intake processes to be viewed as another task to be completed rather than an opportunity for growth. So let's talk about what this looks like today. Patient intake can be a strategic lever for organizations to earn patient loyalty and transform revenue cycle performance by getting accurate patient information on the front end. According to a recent analysis of denials, 1 in 4 denials stems from preventable registration and eligibility errors. Focusing on denial prevention can yield outsized impact in terms of dollars and time for organizations. The best intake experiences help patients easily prepare for their appointments in a way that helps remove the ambiguity that often comes with seeking care. According to one study, while 78% of patients were happy with the care they received, more than 80% would consider switching providers for convenience factors alone. This is important because research shows that patients would look to switch care providers as often as they consider a new cable or satellite service. And if there are options on the market, consumers are likely to make that switch. If you review recent Amazon and CVS acquisitions, you can see how there are new players in the healthcare space looking to offer alternative options to patients. And patients don't stick to providers based on price or quality of service alone. In fact, the most single important predictor of patient loyalty is brand satisfaction, encompassing issues such as access and clarity in communications. Patient loyalty also has a quantifiable impact on the financial health of organizations. Consider the revenue at stake. One patient's lifetime healthcare spending is worth an average of $1.4 million per individual or $4.2 million per family. Organizations need to take every possible step to ensure that they retain their patients. In fact, when patients return for care, organizations dramatically decrease the cost of servicing them. It's estimated that a 5% increase in loyalty can boost overall profitability by 25%. However, many organizations have found that their patient intake process can compromise accuracy of data on the front end, risking clinical and financial outcomes. So why have legacy intake solutions fallen short? Patients want an intake experience that's easy, convenient, and personalized to their needs. The last things patients want to do is answer questions that are not relevant to them or to fill out the same forms over and over again. But since patients typically experience lengthy, confusing, and difficult to navigate intake processes, it's all too easy to accidentally input data that results in inaccurate demographic, financial, and clinical information. To improve the accuracy of patient information, health system staff depend heavily on manual workflows to compensate for the shortcomings of their current intake solution. These manual workflows include contacting patients to confirm registrations, as well as manually reviewing and updating insurance information before entering it into the EHR. As a result, staff are overworked and unable to focus on providing exceptional patient experiences. With turnover at record levels, there are never enough humans to perform all the manual work. Providers also bear the cost of administrative burden, which decreases their capacity and increases risk of burnout. A poor intake process can lead to delays at the point of service and reduce the amount of meaningful time providers spend with their patients. And ultimately, redundant questions and data entry burden result in inaccurate registration information, increasing the risk for eligibility and registration-related denials. Let's take a closer look at the unintended consequences of the status quo. Today, the process of delivering healthcare is still largely dominated by manual interactions with paper forms, repetitive data entry, faxes, and work use. Developing a well-designed intake process has been a priority for organizations to help staff and clinicians prepare for a patient's visit prior to receiving services and to help move the patient through their encounter. And many have started to transition from a manual intake process to a digital solution. And while organizations have tried to work around fragmentation and complexity by investing in intake point solutions or leveraging the EHR, the status quo falls short for three reasons. First, heavy patient burden causes preventable leakage, since most solutions don't have the intelligence needed to keep patients on track with care throughout their healthcare journey. Second, digitization without automation actually creates more work for staff. This means that organizations must continually staff up to compensate, which is not an option for many healthcare groups at the moment. Finally, intake status quo solutions often advance the needs of only one stakeholder group, patients, providers, or staff, at the cost of others, leading to siloed impact and dissatisfaction among the different groups. Previously implementing and optimizing various types of intake solutions in the past, I've seen how many are unable to efficiently collect necessary information for patient care and can leave staff and providers frustrated. This frustration is not only with the gaps in the information that they receive, but how they might also have to search in multiple places to retrieve that information. So how can a solution address these pitfalls differently? Intelligent automation works by sitting on top of your EHR, so your team doesn't need to invest in incremental point solutions. This intelligence should empower patients with a guided experience, free staff to focus on supporting patients with touchless workflows, and deliver organization-wide impact. So what could this look like in reality? Through Notable, patients first engage with a web-based application that is personalized and able to accommodate varying needs. This might be to complete an intake, schedule an appointment, or confirm or cancel an existing appointment. Next, configurable rules engine and AI are able to take that high-fidelity data collected from patients and make sense of it. Finally, digital assistants complete the final steps of writing this information into discrete fields in the EHR. So we discussed the importance of an intake solution and how to start addressing current challenges with intake. However, the process of developing tools to address these pitfalls is unique and important to its success. It's crucial that a team of engineers work with healthcare experts to ensure what they build has a meaningful impact on patient care. This ensures the prioritization of the right tools that embrace human health and well-being, and ultimately results in the ability to scale safely, but with incredible speed and agility in an industry where efficiency and improved outcomes are needed today. Now I'll turn it over to my colleague, Kevin, to walk us through the elements of building the right kind of AI.
AI technology have long promised to reduce staff and provider burden while delivering better care for patients. But in reality, years of investments so far has failed to deliver on real value. So there's a recent political article that outlines some of the reasons why this is the case. And a couple of factors stood out, which is technological. Certainly the technology has come a long way since a couple of decades ago. But other than technology, organization and process factors also plays a big role in inhibiting the realization of value. So in this section, we'll discuss learnings that we have at Notable, partnering with many healthcare organizations and bringing artificial intelligence to bear. And we will go through how we navigate the complex area of implementing AI technologies. Now, before I jump into what are the processes in which we bring intelligence to healthcare organizations, I will do an overview of the types of machine learning and AI technologies that are currently being deployed and are in live services to give you a sense of what are currently available and possible. So to start off, machine learning is a method of implementing AI. There are many ways to construct intelligence, and machine learning is one of them. And I'll go into more details on how this works. At a broad level, machine learning is a system that learns from data and distills patterns into reusable models. So the focus here is the data sets. Without having direct human input or human knowledge, the algorithm is able to find patterns, which gives you the desired outcomes or results. And the performance generally improves with greater quantity and variety of data. Another very important capability in machine learning and AI is optical character recognition, or OCR. So this is the capability for computers to recognize text and also structure the text from physical images or digital files. The ability to use OCR to detect, recognize, convert text to documents is extremely important in intelligent automation because it allows the computer to process things like clinical documents, fax documents, and things like referral queues, and even to read electronic health record screens, just as a human would. Furthermore, apart from processing images, the computer also needs to be able to process natural language or text. The NLP, natural language processing, is a subfield of machine learning that enables computer to understand, contextualize written text. So this ability allows the machine to automate, for example, things like medical document extraction. And here at Notable, we use NLP to do care gap management as well as HCC risk adjustments. Just for some examples, we're taking clinical documents and build models which are able to extract things like data procedure, provider names, time of next visits, and impression and plan to support care gap closures. And we also utilize the same NLP techniques for HCC coding, hierarchical condition category risk adjustments, and we're able to extract things such as evidence and classify diseases. Finally, once we have the AI or the intelligence that comes from the machine learning models, we need a way for the software to perform these actions in the real world. And robotic process automation is a technology that is suited for this purpose. In essence, an RPA robot is an agent that takes action based on the intelligence or decision made by the AI. This is basically a set of software that emulates human actions and can perform these steps with a user interface, just as a human would. So this closes the loop on the intelligent automation process. So I just went through a ton of different technologies. Now, there are many ways in which these intelligence can be built. Now, you may have heard of decision trees or rules engine. This is one way to build an AI. And the other way, which I just talked about, is machine learning. So how do you navigate this complex landscape of various technologies? Now, with decision trees on the left, this is an example of a system that gathers information from the patients based on their responses. And so each node on this tree here is a condition by which a decision is made and the subsequent response being presented to the patient. So this is one way to essentially construct a conversation agent. On the right side, this is an example of a machine learning conversational agent or a chatbot built by Google called Lambda. And as you can see, the responses are very natural. It talks kind of like a human, and it can handle a wide range of input queries. So you don't have to specify exactly what the machine will say at each step. It just responds based on the question that was asked of it. But as you can see, these two methodologies span a wide spectrum of different behavior. One is very deterministic, but narrow in scope. The other one is very powerful, human-like, but seems to be less relevant or difficult to make it relevant for the task at hand. So the real challenge here is to walk this fine line of deciding how we achieve the end results given all these technological choices. So first, we want to understand the pros and cons of each of these methodologies. First of all, with decision trees, or otherwise also known as rules engine or expert systems, we're really taking human knowledge and then encoding them into a set of rules and conditions. So we have this expert rule system that takes in the rules and then also the data that we want to operate on, and it should spit out the answer that we expect. An example which I'll use to illustrate this is the task of insurance payer plan matching. When a patient comes in with an insurance card, the staff often will always need to create a coverage within the EHR that corresponds to their insurance. Now, one way to do this via an expert system or a decision tree is to say, we're going to look at the real-time eligibility plan description and then map each one by one to a plan ID that exists in the EHR. So this is a very simple form of a decision tree that allows this intelligence to be built. Now, from this system, we can see the pros and cons of taking this approach. First of all, it's very interpretable. Somebody can come and read it and audit it and know what to expect given the inputs. So it's interpretable and auditable. It's very simple and fast to implement, often doesn't require any special engineering knowledge. Somebody just needs to write this up, say in an Excel sheet or similar systems, and it will perform, as dictated. It doesn't require any data, just subject matter experts. So this actually saves a lot of time in terms of needing to gather data. You just need to find the right people with the right context and knowledge in order to code this up. Now, associated with this technology is the downsides, which is that once you grow to a certain size and need to manage, say, 40, 50, or 100 rules, it becomes very difficult to maintain. And the interpretability also drops. Now, this is because many of the rules that people, continue to add in or iterate on may create conflicts or ambiguities, and they may start to affect one another with no direct, easily auditable effects. So it's not directly evidence-based approach. We're not using data or empirical experiments to determine whether these rules are actually correct. It's really just based on the human subject experts. So in this case, it becomes very difficult to maintain once you grow to a certain size. A couple other cons is that it's harder to build a decision tree once you're looking at multiple factors. It's okay if we're doing, say, 2 or 3 input features, such as in this case, maybe it's the member ID, maybe it's RTE description, and then maybe the payer. Now, once we start looking at 10, 20, or 30 input features, it becomes very hard, again, for a human expert to build that out and test. Finally, the decision tree really usually only is for structured data, which means a kind of a data table that you can put on a computer, and it doesn't really deal with images or, say, audio and things of that nature. The rules models will quickly become unwieldy and difficult to scale. Now, on the other end of the spectrum, we have our machine learning systems, and it's really a way to scale human knowledge by removing the human from the loop of learning and simply look at the data and the outcomes or the answers that you expect in each of the cases or examples. So if we look at the top left diagram, this looks a bit more complicated than the prior one. In the machine learning realm, we first take input and output pairs that we want the system to learn from, and a program or algorithm will study all these examples and distill down the patterns that it sees that optimizes the outcome. And this basically we will refer to as the model. Once you have the model, we can apply new data to the model and it will generate new answers that you did not explicitly program. Let's take a more concrete example using payer plan matching again. And in this case, we want our computer vision system to produce a model which can recognize different insurance cards and outputs the payer that corresponds to that insurance card. So what is the data that we need? We need a set of insurance card images that the patient have taken either on their phone or already exists in the EHR. It could be hundreds or thousands of the images. And then also the payers that correspond to each image. It could be Blue Cross, could be Medicare, could be Aetna. And we feed all this into a machine learning algorithm. Out comes the model. And finally, we deploy this model to an API service or something that serves the machine predictions. Now, in real time, patients can upload new images of insurance cards, and the machine model can provide a set of probability that corresponds to the payers that are supported. So one thing to note is that machine learning systems are inherently probabilistic, whereas the previous decision tree-based systems are kind of binary. It's either or. It doesn't tell you a probability that something is of a certain classification. So the pros for the machine learning system is that it learns from your desired outcomes. No human needs to directly specify the rules, which could be correct or incorrect or ambiguous. it simply learns from the real world data. It also scales well to complex patterns for the same reason. We can handle structured and unstructured data in the sense that, in this case, images are fine. We can operate on audio. We can operate on text. And it's also probabilistic, which provides scoring. And the scoring piece allows more flexibility on how one can interpret these results, given the confidence of that results. And finally, it's evidence-based, meaning that we're collecting real-world data, doing historical backtesting on it to make sure that it's hitting the right quantitative accuracies. Now, on the flip side, machine learning systems are not easily interpretable because they themselves encode very complex patterns within them. And so it's not as straightforward as a decision tree to interpret and audit the results, although there are techniques to help the practitioners perform this task. It also requires a lot of labeled data, meaning that someone will have to go in and construct this input-output pair. Now, this could be time-consuming and also requires real data systems that is integrated with your production services in order to gather high quality and relevant data. And finally, the implementation, because of this, is much more complex. But overall, the ML method can be very powerful. And we just need to keep in mind that the old saying of garbage in, garbage out. So there's a lot more focus on ensuring high data quality. Now, with all that in mind, I'll kind of take you through what we do at Notable to bring the two systems together into an intelligent insurance payer plan matching solution. So on the left here, you can see the patient experience for taking an insurance card photo and all the intelligence that's happening in the background will parse out the relevant fields such as first name, member ID, group number, coverage start dates, and then also predict a plan for this insurance card. So there's a lot going on in the background, and the challenge is really navigating how we will implement this piece of intelligence that has many moving pieces, each one with a different requirements and also constraints. So when the insurance card comes in on the diagram on the right side, we feed it into a couple of different models. First one is the OCR, optical character recognition, and this allows us to extract all the text from the insurance card. The other model, which is for payer classification, as I talked about in the training piece of the slides, this is for us to predict what the payer is for this insurance card. Since each payer can have different formats and how they handle insurances, this is an important information to predict. Next, we will also run it through a card element extraction model that looks at the layout and the formats for this card to determine what is the member ID, group number, and who are the dependents. So as you can see, insurance cards can come in all sorts of different formats, and learning these patterns requires very complex modeling. It's not something that can be easily coded up by a simple set of rules. So this model needs to be a machine learning based solution. With all that in mind, we feed this information that we extracted into a real-time eligibility system. And then taking all that information, we feed that into a subsequent payer plan classifier or payer plan matching model. So you can see in this model here, we've combined both an expert system and a machine learning system. And the reason for that is because they're across different organizations or systems, there are different requirements on these payer plans matching algorithm. Some of them are deterministic, known, and some of them aren't as clear. And a lot of this decision comes down to how much data there is available, how much existing rules there are that the hospital system is already using. So it takes a kind of a careful approach to put these two together. Finally, once we have the payer plan, we also run a coordination of benefits algorithm, and this is purely expert system based, since these coordination of benefits rules are generally known and deterministic. Finally, we use robotic process automation to take the action of exporting these coverages to the EHR. So this kind of gives you an overview of how we put all these elements together to deliver a real-world intelligent solution. So next, I will hand the talk back to Suzanne to discuss how we use design and AI to build an intelligent intake solution.
Thanks, Kevin. Every organization may approach intake through different methodologies. Some may launch process improvement efforts or develop new ways of collecting patient information upfront. However, we've seen over time that those changes typically involve pushing the workload upstream or downstream, adding to the ever-growing administrative burden. Others have started to use digital intake solutions, and on the surface, many of them can look quite similar. But it's important to remember that just because a solution is digital doesn't mean it's intelligent or more effective than a manual process. So let's talk about the details that truly make intake solutions intelligent. To be effective at driving outcomes like patient engagement, satisfaction, denials reduction, and staff capacity creation, an intake solution must do the four following things. First, it needs to prompt action, actually getting patients to do the things you need them to do. This includes providing vital demographic information, completing a PHQ-9, scanning an insurance card. And the best way to do this is through a high degree of personalization. This is based on well-accepted psychology principles. Next, eliminate hassles. Let's make it easy for patients. The complexity of healthcare is virtually a cliche, but simple things such as populating intake with patient information that's been collected in the past, or not requiring a patient to use a username or password to complete intake, eliminates common barriers to collecting patient information. Third, we want to prevent denials, collecting high-fidelity information directly from the patients. And by doing this, we eliminate the need for staff to collect data, which prevents errors. Additionally, because we have coverage in every EHR field, we capture data that would otherwise be omitted or need to be entered manually later. And finally, unburden staff, ensuring that intake solutions do not create additional work. While intake status quo solutions might collect information from patients, many require staff to manage multiple work queues or reports to ensure that the information collected is complete and accurate. I've seen this firsthand with other solutions that patients may have to repeat or even provide additional information at the point of service if staff don't have time to review their intake ahead of the visit, which is inefficient for both staff and patients. So let's start with the first one, prompt action. When it comes to prompting action, the best intelligent automation solutions are personalized and specific. Here are a few examples of how we do this at Notable. First, on the left, the messages patients receive to complete their intake are tailored to their needs. We integrate with the EHR through a variety of ways to understand upcoming schedules. Based on proprietary algorithms and continual learning of patient engagement, Notable automatically determines the best time to reach various populations. For example, we've learned patients over 65 typically engage best in the morning, so that's when outreaches are sent accordingly. We dynamically determine the best way to engage with every patient. That could be text, email, or phone call, and can respect their communication preferences to drive the highest levels of engagement. On the right, all intake questions are personalized to the patient, ensuring that they only need to provide information that is highly relevant to their upcoming care. And let's be honest, patients don't want to answer the same questions again and again. It's critical to ensure that patients are guided through an intake experience that's purposeful, has clear instructions, and is not repetitive. It's important to focus on a solution that allows patients to complete all requirements, but enhances the experience by leveraging unique capabilities. Notable is white labeled for each organization we work with and can be customized based on the organization's preferences and protocols. And there are vast differences in how organizations choose to structure clinical intakes. Here's an example. On this slide, you see the prompts from two different organizations that we've anonymized, both reaching out to patients who are overdue for colonoscopies based on clinical guidelines. It's important to remember that automation platforms must have a high degree of configurability to provide an engaging patient experience while collecting information specific to that organization. On the left-hand side, the first organization has elected to prompt patients to complete the Cologuard test. Through Notable, and without ever interacting with a human, a Cologuard test can be sent to their home. On the right-hand side, a different organization prompts patients who are overdue for colonoscopies and allows them to book the procedure through a self-scheduling experience on their smartphone. There are also mechanisms available to ensure that patients who interact with the experience receive automated follow-up and results as needed. But nevertheless, organizations need the ability to help shape the patient experience so that they can take the appropriate actions for their care. Next, we'll talk about the importance of eliminating hassles for patients. One of the most painful yet preventable patient hassle is having to enter the same clinical and administration information over and over. This is especially frustrating for patients who consume a lot of healthcare, and truly for anyone who's been handed a clipboard at every physician visit. When overseeing registrations, I would frequently hear my front desk team providing service recovery due to a patient's frustration around providing information that they may have just provided a few days prior. We all want to provide better service. When patients access the web-based application to complete intake, Notable uses multiple factors of secure mechanisms to authenticate without requiring the patient to remember a username and password. This solution provides a remembered experience, pre-filling any data available from a patient so that they only have to update information if it's changed. Another point of high friction for patients is linking care together for multiple appointments. It's important to provide patients with clear guidance at every step. For example, did you ever hear a patient say that they no-showed simply because they forgot about an upcoming appointment or that they received unclear instructions? In this case, our patient Alice has 3 upcoming appointments. Instead of reminding Alice about each appointment individually, Notable reminds her together in a single text message. The link takes Alice to a consumer-grade experience where she can easily understand the upcoming appointments she has and cancel them individually as needed. Patients' feedback shows that they enjoy seeing all their appointment information in one place. The more messages and reminders patients receive, the more likely they are to start ignoring those messages, or at the very least, it can cause confusion about their upcoming appointments. This is why simplifying communication is key, especially for patients who receive care often. But consolidation isn't the only way to eliminate hassles. A best-in-class intake solution needs to engage patients using their preferred language. At Notable, we support any language, device, and communication channel, including assisted voiceover for patients to ensure accessibility. This helps drive both accessibility and high utilization, usually 3 to 5 times that of other traditional intake methods starting on day 1. And I've coached teams over and over again about the importance of collecting payments at the point of service. But when a patient isn't feeling well and is focused on getting in quickly to see their care provider, registrars can feel uncomfortable asking for payments, leading to low collection rates. To address this and add convenience for every patient, we make it easy to pay a copay or an outstanding balance the same way we pay for everything else in life. This could include using a saved FSA account, a saved credit card, or even Apple Pay. And we hear this quite often, that many are concerned that certain patients don't want to interact digitally. And historically, that might be true. They maybe have used a digital experience before, which presented them with endless options, depersonalized experiences, and a process that required quite a bit of stamina. So that's why it's important to note it's not only design that drives outcomes. On this slide, you can see what we call the patient intake conversion funnel. This is the journey that we track for every patient communication produced by Notable and a fundamental element of driving outcomes. As you can see, there are many blockers at each stage of the funnel that can prevent a patient from completing the intake process. But Notable has devised targeted solutions to drive momentum through the funnel. We look at this data religiously for each customer and in aggregate to ensure that any dips in conversion rate are managed swiftly and with the right intervention. This also provides the opportunity to aggregate best practices across organizations and foster moving KPIs higher and higher over time. The next area that makes our intake intelligent is denials prevention. Kevin provided us with some details about payer plan matching, but let's also take a look at this from the patient's perspective and go into some more detail. As we've discussed earlier, about a quarter of denials come from registration and eligibility errors. These are highly preventable. A truly intelligent intake solution should produce a sizable decrease in denials volume. It's also important to note that many solutions start addressing denials management on the back end and rely on training and education of front-end staff to improve the information collected prior to a patient's encounter. However, given the complexity of selecting the right payer and plan, this can be a difficult task even for the most experienced staff. I always remember my administrative team asking for more and more training on insurance, and honestly, it just never seemed to be enough. And with insurance card updates and new plan options, it's no surprise that it continues to be difficult to collect this information accurately. Lots of intake solutions on the market function as a digital collection tool. They enable patients to snap a photo of their insurance card, but that's where their capabilities end. Most require staff to manually enter or at least confirm the member ID number and select the plan from an ever-growing and sometimes outdated list. While collecting that information is an important step, it doesn't deliver significant outcomes in an intake process that truly requires a dynamic logic, additional actions, and continuous improvement. Using intelligent automation, Notable approaches the problem differently. First, we always ask patients to confirm whether the information we have on file is still correct. If something has changed, patients simply take a photo of their new insurance card. Then we extract these card details down to the PO box using OCR or optical character recognition and make sense of them with machine learning. Finally, Notable's digital assistants select the patient's precise plan in the EHR. We use our supervised machine learning model to continuously get better at plan selection. And as mentioned throughout, another crucial component of intake is unburdening staff. With Notable, patient intake becomes completely touchless for staff. Let's take a closer look at the EHR, what the EHR looks like before and after. Of course, this will look a little different depending on the EHR. For patients who have not yet completed registration, the top screen represents what staff would see. When the patient completes their intake experience, the Notable digital assistant will update the EHR. And the bottom screen represents what this would look like after the patient has completed their registration. Depending on the EHR, indicating that intake has been completed can be found in a few different areas, so it's convenient for staff to see and review. Given that intake information must be entered into fields across registration and the clinical chart, it's important to consider a solution that can access data fields others methods traditionally can't reach. This is important not only for user experience, but ensures that critical information is captured and appropriately documented. Traditionally, technology vendors have been limited by interface access supported in EHRs, be that RESTful APIs, FHIR, HL7, etc. We know that these can be quite limiting and can be slow and expensive to work with. And it's one of the reasons staff may still need to manually collect certain components of intake. So how do you solve for this? You should be looking for a technology that can read and write into any field within any system that the staff can access. Our team uses techniques to reach custom fields or fields historically unreachable with other solutions. Doing so means that we're able to support workflows that haven't been supported before. As we mentioned today, it's important that solutions are able to embrace customization and use intelligence that provide flexibility and efficiency. Organizations may vary in their use of EHRs based on the needs of their clinician and patient populations, and digital solutions without automation are limited in their ability to meet this need. Through our iterative process, integrating expertise across disciplines, we've seen that technology can drive results and streamline complexity so every patient can engage and receive the care that they need. So what results have our partners seen utilizing a platform with intelligent automation? Well, the outcomes speak for themselves. By reimagining patient intake with intelligent automation, Intermountain increased copay collections by 300%. This is made possible by a patient-centric and remembered front-end experience that makes completion quick and easy for patients. At Reed Health, no-show rates decreased by 30% among geriatric populations. Compared to the industry standard of 5 to 10%, Reed's 56% intake completion rate among geriatric populations can be attributed to the platform's user-centric design, configurability, and low barrier to entry. By getting more accurate patient information on the front end, Austin Regional Clinic cut eligibility and registration-related denials in half. They also reduced documentation by 45%, freeing up staff and providers to provide world-class patient care. Today, we've looked at AI through the lens of our intake solution. However, these capabilities and intelligence can be leveraged across a platform, whether that be to increase the speed of the authorization process or identify care gaps. Intelligent automation is a crucial component to enhancing critical workflows and creating a measurable impact. On this slide, we outlined 5 core areas where Notable helps healthcare systems accelerate their patient access, revenue cycle, and growth initiatives. All of these solutions are powered by a single intelligent automation platform. This allows healthcare systems to leverage the power of one platform to further eliminate manual workflows and create a seamless experience. Our multidisciplinary team prioritizes how the smallest detail can add tremendous value to patients and care providers, and focus on utilizing the right tools to maximize that value. Given all that we shared today, we'd like to emphasize the outcomes that can be produced by leveraging intelligent automation that is focused on improving the experience across the continuum of care for all those involved, patients, providers, and staff. I want to thank you all for joining our session today, and we look forward to answering your questions.
Suzanne and Kevin, thank you so much for sharing how healthcare organizations can transform how patients access care with intake. And thank you to our audience for your thoughtful questions. Please continue to submit your questions through the Q&A box. And if we're not able to answer your question on the line today, we'll be sure to follow up with you after the webinar. Okay, great. So let's see. Our first question today is for Suzanne. Suzanne, what EHRs does Notable work with?
Really good question. So Notable in particular is EHR agnostic. We have partners that work across different EHRs. And with many of the tools that we've discussed today, that's where we're able to access fields across those different EHRs and essentially present them in that user-friendly experience. But again, we work with partners across all different EHRs.
Awesome. Thank you so much. Next question is, how does Notable accommodate older patient populations who may not be as tech savvy?
Yeah, another great question, and one, frankly, that we hear often. And I think something to think about when you're looking at different solutions is utility across different age groups and making sure that it's accessible to everyone. Our data actually shows that older patients really enjoy the process of completing forms digitally. In fact, with a lot of our partners, we've seen completion rates of like 52% among geriatric populations who often perceive there's a perception that they're less likely to engage digitally, but we're seeing that this is actually changing over time. And when we look at the platform, there's a few reasons for that, but mostly that it's really focused on being patient-centric, and the design and the configurability really enhance that experience for patients. Another thing to think about is the utility of being able to use this at home with a caretaker. And we have several methods to really optimize conversion methods. So we work with a data science team, and they'll look at everything from the wording of the text as well as the time of day that we're sending those texts to make sure that it's actually, reaching the patient and accessible to them at the right time, right place, with the right details. And of course, to learn a little bit more, we actually do have a case study with Reed Health where we work with their geriatric clinic to complete intake, where they have a high, of course, Medicare population, and we're able to receive a 56% intake completion among that group. So really great one to look into, but yes, definitely want utility across all age groups.
Awesome. Thank you so much, Suzanne. If you're interested in the Reed case study, please check it out in the webinar module. Okay, great. So next question is a little bit of a two-parter for Kevin. First, can the machine learning models have errors? And second, where does the data for training the machine learning models come from?
Okay, great. Thanks for those questions. So absolutely, machine learning models can make errors. As we talked about, the model is only as good as the data that you feed it. So if there are errors in the data set itself, whether it's from human errors making those errors, or just from the natural variation of what happens in the real world, the real world is complex and noisy, those can also get incorporated into your models and come out as errors. But it's good to also remember that machine learning is not just building the model, but it's the whole process of auditing and evaluating models against historical data to understand where it performs well and where it doesn't. So this whole practice ensures that the models that you put out into service performs as expected. There may be some edge cases or errors, but that's practitioners learn to deal with these edge cases and make sure it's performing up to the level that you need. And then to the second question, where does the machine learning data sets come from? So there could be a variety of sources depending on the tasks that you have at hand and what kind of data collection systems that you have. We can collect data directly from the service itself, such as patient uploaded images, responses from patients, or we can get inputs directly from the EHR, things like plan that is selected by the staff, or we can utilize subject matter experts to label data directly for us. Things like figuring out what the payer is for specific insurance cards, or have experts go through clinical documents to annotate and find ICD-10 codes, disease and diagnosis, plans and assessments. So we kind of utilize as much as we can in order to get the most comprehensive set of data for the machine models to learn from.
Awesome. Thank you so much, Kevin. The next question we have is for Suzanne. How do you ensure that we don't require too much from patients during their intake process? We don't want to move the administrative burden to our patients.
Yeah, another really, really important question. And as we talked about before, we know that it can be really burdensome for patients to fill out a lot of information. So this is an important note to make. And any of the information that we're absorbing, essentially, are forms that are completed today. So they're already required. So we're not asking for anything additional for patients. In fact, we have the ability, especially for existing patients to the healthcare system, that we pull that information forward. So as they complete intake for other visits, all they really have to do is clarify that the information is still valid, which I think is just a huge satisfier among any patients who are filling out this information. They just don't want to fill it out over and over again. So it's really thinking about providing a simple digital experience, a mobile experience for patients so that it's really accessible. And they're not having to do that work on a clipboard with a form that just has, endless fields and so on and so forth. And we're really seeing that our patient satisfaction with this is quite high, approximately 97% patient satisfaction when they complete our intake. So we get a lot of good feedback, and we really help use that feedback to continue to make improvements.
Awesome. Thank you, Suzanne. And with that, that concludes our webinar for today. Thank you so much to each of you, our audience members, for joining our discussion. We hope you'll tune in for our upcoming webinar on October 13th, the post-call center era, how intelligent automation can reduce call volumes and increase patient satisfaction. Thank you so much, and we hope you have a wonderful rest of your day.